All right. Why don't we go ahead and get started? I know people are filing in, but they'll be here in time for the main event. Good morning, everyone. Welcome to Department of Medicine Grand Rounds. I'm filling in for David Cohen, who has a little bit of time off, so you're stuck with me. But not stuck with, gives me great pleasure to introduce our speaker for today, who's the Dean of the Rutgers School of Public Health, the Hunterdon Professor of Public Health and Health Equity, Distinguished Professor of Biostatistics and Epidemiology, who came and joined Rutgers in 2017. He holds the status of Professor Emeritus of Global at the College of Global Public Health at New York University. He's an elected fellow of the New York Academy of Medicine, the Society of Behavioral Medicine, the American Epidemiological Society, National Academy of Practice, American Psychological Association, the European Academy of Translational Medicine, and the College of Physicians of Philadelphia. Dr. Halkitis has done most of his training and spent most of his time in New York. He has his bachelor's in biology and psychology at Columbia, his master's of education and human development at the Hunter College of City University of New York, where he got his master's of philosophy and PhD in quantitative methods and educational and psychological research, the Graduate Center of the City University of New York. And then finally an MPH in urban public health epidemiology at the School of Public Health at the City University of New York as well. He spent nearly 20 years at NYU, where he rose to be a senior associate dean for academic and faculty affairs before coming to Rutgers. He's an infectious disease epidemiologist, applied statistician, and public health psychologist. He's authored 6 books and 300 peer-review articles. He's been editor-in-chief of behavioral medicine since 2013 and is the founding editor of the Chief of Annals of LGBTQ Public and Population Health. He's received numerous awards, as you might imagine. We won't go through them today, from both professional and community-based organizations. Lastly, what I'll say is that in 2023, in recognition of his lifelong contributions to scholarship and education, community engagement and activism, they established under a gift the Perry N. Halkitis Endowed Chair in LGBTQ Public Health was established so that just 2 years ago, which will really ensure that his sort of research on the importance of LGBTQ health will remain sort of forever emblazoned in Rutgers School of Public Health. So without further ado, thanks so much, Dr. Halkitis, for joining us this morning. Please take it away.
Yes. So, and we can see my screen?
Yes.
And let me put my slideshow on. So, Jean, first of all, thank you for that extremely lovely introduction. I will add only one more thing, that like so many of us, I am the proud child of immigrants who came to this country in the late 1950s, early 1960s from Greece, forged their way and provided me with every opportunity possible to be able to be here to speak with you today. It is part of my identity that sits in my heart front and center always when I think not only about my own life, but when I think about public health and medicine and the things that we can do collectively together. I had the pleasure last night of doing a panel at Manat Health with Vin Gupta, who was also going to be our graduation speaker this year, I'm happy to announce. And it was Vin and I and another colleague who works at Jamaica Hospital talking about how we provide humanity back to public health and to medicine, and how we put the whole person at the center of the care that we provide in both prevention and in care. That's a time for another grand round, so you'll invite me back for that one, Gene. It is also the cornerstone of my book that I'm going to end with today. But today, as I was given free rein to speak about anything I wanted to speak about, I might have chosen to speak about my 3 best Oscar films, but I in fact will not be doing that. I may tell you them at the end of the talk, but I will talk about the School of Public Health that I've had the great honor of leading for the last 8.5 years. And I will say, like so many New Yorkers, I did the thing that you were not supposed to do, which was like go from New York to New Jersey, but I did it, and it was the best decision I ever made. Because being here at this school and at this university, being able to serve in a public entity, being able to serve so many first generation scholars, in their efforts in medicine and public health and nursing has been so fulfilling to me because I am one of those. And like so many of those, I was dependent on the public education system to complete my degree. So I will also just say to you as I proceed into this talk, which is a lot of information and then some suggestions. Um, when I first came here, the New York Star Ledger interviewed me and asked me this question: which school of public health would you like to be at? And this was at a time when our school was like in the low 30s and the top in the high 40 in the low 40s and the top 30s. And I was like, we have work to do here. And my answer was none of them because I wanted to forge something new. And so my conversation today is going to be really how we think about at the School of Public Health in this moment of leadership transition at Rutgers Health that is going on, at this moment of Rutgers University leadership transition. How is it that public health and medicine get further intertwined with each other to do the work that advances the health of all people and all populations? So the talk is going to really focus in first part on sort of the structure of the school because it's really changing. I don't know how many of you are aware of what we have and what's going on there, but I thought that would be a really good introduction. Then go to some opportunities for collaboration that I've actually shared with the executive vice president, and then hopefully leave some time for questions and answers at the end. And I won't read, but because you all can read, but I will start by just saying that the goal of our school, the mission of our school, resides in high quality education, innovative research, and collaborative community engagement. And why do I put those in red? I think in too many institutions in higher education, one of those areas is prioritized over the other. In my perspective, a good school of public health, an effective school of public health, teaches its students. It does amazing research. Sometimes it's NIH funded, sometimes it's not NIH funded. It's still effective research and actively works with and for the populations that it serves, right? Very much like the patients that you're seeing, very much like the people that we're working with, research that is in and of the people. And so much of the conversation last night with Vin and Sabiha was about how we meet people where they are, right? Because if we continue to have this disconnect and not meet people where they are, we're going to continue to lose people to misinformation, disinformation, and faulty decision making around health. So we envision a future where all people can achieve health and well-being. We are driven by a set of principles, including academic freedom, collaboration, collective excellence, creativity, impact, integrity, respect, and solidarity. And those are the value systems that we have in our second iteration of our strategic plan, which just launched this September at the Heart and Soul. And again, across these three domains. The strategic plan is available. I will provide these slides. You have these slides, right? You can share these slides with everyone. But our strategic plan is here that outlines all of this. I'm very proud to say over the course of the last few years, we were able to achieve the majority of our goals in our first strategic plan, like 98%, and now we're on the next level. I think a really important slide is this one. And what you're able to see here are the areas of excellence. And why do I put this slide up here? I put this slide up here because I think we are going to focus in the next 5 years in not having more breadth, but having more depth. And we choose the areas in which we are effectively known at this point in time. And those include environmental health justice and sustainability. We just launched the new MS and sustainability that is going to be available to students. Sexual and reproductive health. We have two of the leading abortion rights leaders and researchers in the country at our school, Laura Lindbergh and Leslie Cantor. Leslie Cantor, who was the executive vice president for at Planned Parenthood of America for a very long time before I was able to like lure her away. Modern epi and biostatistical methods. Everyone loves a chi-square, but we can do better than that. Infectious disease epidemiology, prevention and care, maternal and child health, mental health and substance use, violence prevention, and population health and health care. And look, if any of you are familiar with any of my work, you will know that consistently I've written about syndemic, 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 syndemic. Show me one health problem, I'll show you another health problem. And I think I don't see these as eight isolated buckets. I see them as intertwining. I see that when we have violence, when we have intimate partner violence, or when we have firearm violence, we tend to have mental health and substance use issues, or we tend to have infectious diseases. And how do we think of collectively in public health and in medicine about treating not just one issue, but the multiple issues that the person is facing, and at the same time, the determinants, which some people would call social, um, I'll call them hate, which are driving so many of these health conditions. Oh, sorry, okay. So I'm just going to show you here also. These are our goals for the next 5 years. They're updated. You can see them: enhancing the research infrastructure, expanding our educational programs, and continuing our community engagement. We are doing a reimagining of the MPH right now. And why are we doing a reimagining of the MPH? We're doing it because one, we can't continue to do the same old thing. You all know that. We can't continue to teach a new generation the same way. And our students are asking for something different. And so we're thinking about how is it that we take these 8 areas that we're good in, and how do we take these 4 departments, which I'll share with you in a minute, and make them more interconnected with each other and less isolated from each other. And so that is the goal of that reimagining plan. I'm extremely proud to say that now we are now the number 16 school of public health. And numbers sometimes really, I am a biostatistician, so numbers always matter to me. But this number is like the number that makes me very happy because it is based on how others perceive you. And so in some ways it's a faulty system, right? Because there are not objective measures. But I'll take the fact that my colleagues around the country believe that we're the number 16 school of public health. Because if they think that, then people think that also. So I'm very, very proud of this accomplishment. Let me talk about our programs. We have 2 sets of programs: a doctoral program, which is our PhD, which is our research-based full-time program, doctor of public health, which is our part-time weekend distance program. The latter program is for individuals who are working in medicine, who are working in community-based organizations, who get a doctoral degree, where they do mostly online and come in once time a year, and it's more practice-based. The doctor of philosophy is more research-based. We have all of these master's degrees and these additional programs. One might ask, where is that undergraduate education program, Halkitis? Why don't you have that? And Halkitis will say to you, well, one day I might have it. But in fact, right now it's in the Blaustein School because years ago, because of historical effects, kind of like that constitution that doesn't really want to change from like 1787. Things tend to be slow in changing here, but there's conversation about how we do that. We do have a bachelor's MPH program. We do have many combined programs, including with you and MD MPH, where we've had numerous students over the course of the years that are, being able to integrate their work across 2 schools. Our biostats and epi department, led by Jason Roy and Emily Barrett, who you see here in these areas and their degrees, has these various degrees. Our environmental and occupational health and justice department, we just added the word justice a few years ago, led by Helmut Zarbel and Wendy Purcell, shown here. Our health, behavior, society, and policy department, led by Paul Duberstein, that has 2 really, 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 I think, interesting new concentration in population aging and population mental health. In response very much to what we're seeing in our society in terms of the needs and training students on the cusp not only of public health, but public health, clinical care, psychology, and psychiatry, because they are dealing with these issues in their real lives. And then this conglomeration department, you'll notice it's called urban dash global, not urban and global, because we believe urban is global and global is urban. And it has all of these very interesting concentrations in it. Our global public health program is one of our biggest concentrations after epidemiology and is led by Leslie Cantor. Um, just some numbers. We have 93 primary faculty, diverse in many ways, excellent teaching. And when I first came here, having been at NYU, as Gene said, you know, and those of you who know NYU knows that NYU just like conquers the world and builds buildings in all the parts of the world because, you know, they have more money than God. I came here and we had a global program. I'm like, oh my gosh, how are we going to do this here? We don't have all the money in the world here. So what we were able to do is build collaborations with our colleagues at various universities. So for example, I'm going to give you an example of what that's led to. Besides the research collaborations which existed, we have now built an educational program. I just returned from 2 weeks in London, England in January, because who does not love to be in like rainy, dark London in January? It's just awesome. Um, I did happen to see The Devil Wears Prada, which was absolutely horrific, and I recommend you never see that. Um, but we did an HIV prevention and counseling course, which I developed at NYU 20 years ago. And somebody asked me, I said, "Why did you go to London?" And I'm like, because I wanted the students exposed to the national healthcare system, the national health system. I wanted the students to be able to go to clinics where there was a physician and a nurse and a psychiatrist and a financial person and a caregiver and all of those things that deal with the whole person, the whole HIV positive person. And so that is epitomized in the NHS, especially at the Mortimer Street Clinic, which is on Tottenham Court Road. But since then, we have built these collaborations with all of these universities. And what we do is we go to those sites with our students. Our students get matched with students at those universities, and they do a 2 week course together. So we just came back from London. We're doing a course this summer on food sustainability in the Mediterranean diet in Athens. Weather a little nicer in June than it was in London. We just did a course in Manizales, Colombia on Latin American health. And these courses are open to all of our students. And they hear from medical doctors. They hear from, you know, researchers. But mostly what they do is that they go out and work with the community. We did our migration course in Greece a few years ago. The students were in Athens for 4 days, and then they went to the island of Lesbos, and they worked with the migrant population that was in Lesbos that had just come over from Turkey, assisting the doctors with the vaccinations and care that they were providing to the migrants who were there. So really hands-on. I think you're getting a sense, really hands-on, advocacy-based, activist. We believe in medicine and we believe in public health. I will just tell you also my bias, as I tell my students all the time. Social determinants are exciting and good, and of course I believe in them, but there's something called biology too. And so biological factors in combination with psychological and emotional factors and social factors is what our courses are built all around. And in fact, we will be embedding starting next year, a new course for our students in public health biology because Dean Halkitis is so exhausted of teaching his HIV course and having to explain retrovirus, let alone virus or fungus or bacteria to his students. So I think it is very important, especially if we want our students to be able to work with all of you in medical settings, to be able to have that vital, vital, vital information. And so we're doing that. Um, we have 3 fully online MPH programs, the DRPH program, etc. Our programs are synchronous and asynchronous. I like to call the synchronous courses the courses that people offer online where people are at home in their pajamas as compared to being in the classroom, and the asynchronous courses which we've developed. Our research program is also widespread. And, you know, in addition to working with the standalone centers at RBHS, I know I should be saying Rutgers Health, at Rutgers Health, we also have key entities within the school. Those include the Center for Public Health Workforce Development, which is led by Mitch Rosen. And this is a center that does training around fire safety and asbestos removal and all of those really important environmental and occupational health systems in our environments. They train thousands and thousands of people in New Jersey throughout the year. My center, which focuses on HIV, substance use, and mental health, our Center for Gun Violence Research, which is one of the few in the country, led by Mike Anestis, our Center for South Asian Quantitative Health Education, which is led by Jaya Sadakopan, and our Center for Cancer Health Equity, which is led by Anita Kinney. So these are not only centers that do research, but they're opportunities for students within our school to work in real time, hands-on, in these labs. I have, in any particular semester, 10 to 15 students in my lab volunteering. Sometimes medical school students in my lab learning to do hands-on work on these areas, leading to learning how to do data collection in real time, learning how to deliver HIV tests in real time, learning how to do research papers in real time, doing everything from soup to nuts on research, from the inception of the idea to the actual execution and community engagement. We also have three developing centers. Our Center in Arts and Health, which is with the Mason Mason Gross School of Health, Mason School Gross of Art of the Arts, which we're building, which is this really interesting idea that art is public health and public health is art. You know, when I was teaching that HIV course the first time 20 years ago, when I was out there being really like thoughtful about like what the students should be reading. I thought, well, what should they read first? Of course, they should read the MMWRs from 1981. Of course, they should. And they do, right? But they also should be reading plays from the 1980s and short stories from the 1980s. And so this is what this center is all about. How do we bring art and public health together, building on the long tradition of music therapy and art therapy, but taking it to a whole other level. The Center for Health, Whole Person Health is being led by our new Vice Dean, Deanna Kerrigan. And then we just recently hired Tamara Taggart, who is going to build the Center for Sexual and Gender Minority Health, which is going to start within the school but be expansive to all of Rutgers Health over the next 5 years. This was an initiative that Jean spoke about that was funded by James Doherty, who was a member of the Board of Governors, who funded this thing after that guy named Halkitis. We just call it the LGBTQ chair because that just seems nicer. And it's also $2 million from our former chancellor to help build this. And so this is going to be an opportunity. And Gloria Bachman, your amazing colleague who was there last night being wonderful and amazing, and as she always is part of the initial conception with me of what this would be like. And it would be a place where, if we think about Fenway in Boston, the Fenway Institute that does research, but does policy and does care. This is kind of a model we're going with. Bring all the educational pieces together around LGBT and in one place. Bring the research people together. Don't take away their identity. Just bring them together to like collaborate and do cross-school collaborations and cross-university collaborations. But also, how do we become a patient navigator site for people who are LGBTQ in the state of New Jersey? Why are people in the state of New Jersey going to New York and Philadelphia for care when we have perfectly amazing people here at RWJ and in JMS? They don't know that. And so this is so many of the folks at the medical school were involved in the conception, the initial conception of this. And I'm excited, and we'll be launching this hopefully over the next few months. And I will be sharing with you the proposals that we put together for this entity, which I think RWJ Med is going to be very, 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 if not the most important partner for us as we move forward. Our two new leaders that I just spoke about include Deanna Kerrigan and Tamara Taggart. Deanna is the vice dean. She's building the whole center. Tamara is building the LGBT center. I just did this fell swoop. I just did this, like, people would call this a cluster hire, but in fact, I just went to GW and like took people. And they just arrived here recently. We continue to do really effectively in our research program, as you can see here, with this huge blip in 2023, which was leftovers from like COVID money, but continuing to do really effective scholarship. Last year, as you know, in the middle of the chaos, oh wait, there's still chaos. In the middle of the chaos, we lost $11 million in grants. We got it back. We got it back because we have a research office that has fought and advocated and worked with the state, and we've got almost every single penny back of that money. What will happen in the future remains to be seen. We're doing a series of sessions and trainings with our faculty about words, about abstracts, about the new criteria at NIH, all of those things that are changing rapidly to be able to continue to succeed in this way. And then finally, the last pillar, community engagement. We believe very, very, very much that our work has to be with and for the people that we serve. These are some of the entities that we've worked with over the course of the last 8 years. And right now, tomorrow, we have been nominated by our association, which is the Association of Schools and Programs for Public Health, for the Harrison Spencer Award, which recognizes outstanding community service. So we have a site visit tomorrow with them. Hopefully we'll win this award. It would be an amazing award for us. I think we're very deserving of it. I'm sure there are others who are deserving of it too. And that's what's happening tomorrow. We also, during the height of COVID, for those of you who were here, knew that we developed a community contact tracing corps for the state of New Jersey. The governor's office contacted us. We were able to develop a program online on contact tracing. Of course, we all know this. You all know this perfectly well because you were in the front lines there. Contact tracing really works when you have a few cases and you're doing it really at the beginning, and we were a little late to the game, right? So it's like, Nonetheless, it was a great opportunity to give our students real skills, and we were able to put into the world some 1,000 contact tracers who are now spread out through the state of New Jersey. We also have, with Amy Murtha and Leslie Cantor and Laura Lindbergh, this burgeoning maternal health area at our school. And so Leslie has forged a really strong collaboration with the former first partner of the state of New Jersey, but also with Amy and others in continuing to advance maternal health, because you know the indicators as well as I know the indicators about maternal and child health in the state of New Jersey. Not what we want it to be at all for such a rich state. And of course, this community engagement that I spoke about earlier, including this trip that took place to Manizales, Colombia, recently. In right before COVID, we pledged on to this anti-racism pledge, which I think we're probably not allowed to say under the new administration, but we're going to say it anyway. Which we did with all of our partners, including Clara Moss and Newark Beth Israel, and just committed to anti-racism in the state of New Jersey, both in public health and in healthcare. And we embedded in our curriculum, and I think in a very intelligent way, learnings about anti-racism and learnings about how racism manifests both in clinical care and in public health. And in most schools, what they've done is actually develop separate courses. And my feeling was like, you don't do that because when you do that, one, you other it and you say, oh, everything you need to know, everything you need to know about women is in that one course. Everything you need to know about LGBT people, that's not how it works. You know that. And you know that by the way you train your students and the way you serve your patients. And what we did instead was embedded learnings about anti-racism and about maternal health and about LGBTQ health and about immigrant health into all of our core classes. So there's a set of readings that cut across epi and biostats and policy and social behavior and environmental, a set of readings that they do that they analyze from the perspectives of those particular classes. And so there's a consistency and they're getting a full comprehensive view of those topics, but from all of these different, disciplinary orientations. And that's how we've done it in our program. Okay. So about a month ago, our new executive vice president, Kina Arbuthnot, asked me to think about what are some opportunities for the School of Public Health with the healthcare system. And she, shared with me, some concerns that we were perhaps not as integrated as we could be with all of you. So I and Deanna and others put together a set of ideas. These are just ideas. A vision's just a vision if it's only in your head. And it's just a starting point for some conversations about how we might be able to work together with the medical school, with the healthcare system to have public health contribute, but also to have medicine contribute to our school. Because I think having doctors, clinicians in the classroom with our students, having doctors, clinicians in the research labs with our researchers is incredibly, incredibly important. Not that there aren't MDs in our mix. There are certainly MDs in our mix, but the MDs that you have working every day with patients, coming and speaking and working with our students is really a treasure that has not been at all prioritized in the past, and I think has to be realized further in these next 5 years as we continue the strategic plan. I want our students to be able to go out there and talk about what it is for people who are seeking treatment and the obstacles that they face because they've seen it, because they know the challenges you all are facing in your clinics and in the hospital, that it's not this abstraction, that it's not just about social determinants, that it's about biological determinants. Why people avoid getting mammograms. Why is it that, in Greece, only 40% of women get mammograms? Like, what is that? Like, why is it that the woman living with HIV and the 4 children who has antiviral therapy and should be completely virally suppressed is not taking the medications as prescribed? What is that about? Is that about the pharmacy of the medications? Is it about cost? Is it about just her life? Right. So this is the holistic thinking that I think is critically important to public health folks as they move forward. And medicine has to be at the heart of it. We all know that public health developed as a discipline over the course of the last 100 years because it was medicine and psychology and psychiatry and nursing that came together. And unfortunately, I will be the first to say this to my public health colleagues, we've become too insular. And If public health is really public health does this with its partners. And we are perfectly situated at Rutgers Health to have partners with all of you and with nursing and with pharmacy and the health professions to do this work. So what are some opportunities? I just list them here. About strengthening the integration between us and the healthcare system along the three domains. We are proposing to do a landscape analysis to identify where are the gaps. I think I have some idea of where the gaps are. But I also thought my curriculum I teach biostats every spring, and one of the things we did is we did a DE. Well, not to say that we did an assessment of how comprehensive our work was in terms of representing various voices in our work. So in biostats, were there enough women authors? Were there enough people of color authors? Were we talking about topics that were about not just about men, right? Cisgender men. Were we talking about children, right? And so we all did this on our syllabi, and Halkitis said, no, my syllabus, I'm sure is perfect. Right. And of course, it wasn't perfect. And so we've been able to do this landscape analysis of our syllabi. Now let's do our landscape analysis of our collaborations and where we're not doing it. We're doing it well. We want to be able to align our training with clinical care delivery to improve population health outcomes and look to you for that collaboration. Leverage, particularly for the RWJ School of Medicine, these 8 areas. If you need help in these 8 areas, we are the place to go to, and we will help you. Um, and I will come back to this idea of the urban public health paradigm that I'm going to end my talk with today. Creating interdisciplinary learning experiences where we have students in the classroom from all of these from both clinical areas and public health areas. Continuing education and professional development for clinical providers. So one of the things I want to talk about today is somebody we're trying to hire and maybe thinking about the School of Medicine working with us to help hire that person, and broadening the pathways for medical students to earn their MPH degrees. I mean, come on. Like, we want that. We want students who are like the people on, what was that horrible show that was on for a while, that New Amsterdam, which was really like a medicine public health program. It was really good the first 2 seasons, and then it wasn't so good. But that was to me a beautiful manifestation of public health and medicine in action. We make it really difficult for the medical students to be able to get their public health degrees. How can we make it easier for your students to come and be in the classroom in a way that's going to let them be able to get that MPH? And we have many ways. There could be a full MPH. That requires some thinking, but there can also be these certificates we have in population health, in mental health aging, right? That are less cumbersome. And if we're thoughtful and we think about ways for the state to help fund our medical students to be able to do that work, then we're able to get them integrate. We can work with you to integrate it into the curriculum in a way that's not taxing to them, taxing to you, taxing to us, and taxing to the students. And that's how we create a next generation of medical providers who have this public health training, but also public health students who are influenced by the thinking of medical providers. Also, what are the courses that our students might want to be thinking about taking at the medical school? Like, there are some who probably would be incredibly well suited for some courses there that they need to take. So thinking about that as an opportunity, building multidisciplinary teams, obviously working on development awards and grants, continuing our NIH funding, whatever that means. I don't know. Like, who knows? I know. And then increasing our joint studies using clinical data to address population health, right? There's no reason why we can't work with the healthcare system to be able to use clinical data to put out really meaningful publications. Community partnerships, obviously, community-led initiatives, that is at the heart and soul of what we do. I think we do it better than anyone, being able to bring our medical school colleagues, our dental school colleagues with us to the table to have these meetings with these community entities that ask us all the time to talk about working with them, and then to do this shared authorship and partnership, both with you, but also with our community partners. I think community partners have to be the heart and soul of everything that we're doing, especially as Rutgers School of Medicine becomes health equity, as establishes health equity at its heart. It means that community folks have to be at the table with us. So here's the opportunity. I am talking to Lisa Boleg right now. I'm doing another GW Steel here. And it's just like this is my theme for 25, 26. Lisa Boleg does incredible, incredible work on intersectionality. and the world and how intersectionality affects health equity, how intersectionality affects policy, how intersectionality affects people's lives. We are talking to her about coming and joining us and doing an intersectionality, developing an interdisciplinarity trainings that would be designed for clinical care scholars, for faculty at the medical school, for students, for people at public health, and they will be designed specifically to the needs of those populations. And so I'm hoping we could be able to bring her on and do this really, really incredible work that she's been doing at her institute for decades, and helping our students really think about the multiple identities people hold and how those multiple identities influence them. I'm a Greek American. By the way, I do have my Greek citizenship, which I went and picked up my passport. At last time I went and voted in 2024, and then I went to the embassy and picked up my passport because I just thought, like, let me balance this day out somehow, you know. Um, and so I'm a Greek, I'm a New Yorker, I'm a New Jersey employee, I'm an uncle, I'm a gay man, I'm a cis man, I'm an elderly man. I'm all of these things, right? I'm the child of immigrants. All of those things influence how I approach my health. All of those things influence how I approach my life. And so Lisa provides incredible opportunities for people to think about those things in real and meaningful ways at her Intersectionality Institute. We are close to trying to bring her on. If we get closer, Jean, I'm going to reach out to you to have conversations with her and others who want to have a conversation with her because I think we can get her here at least at a part-time basis. Finally, I'm going to end my talk today and give us a chance for opportunities by talking about a couple of things. Let me start first of all with the picture at the bottom with the little people in the center. So years ago, I was at when we had this thing where we had these like big idea. Who was here for the big idea stuff, right? That was like we were doing, and then we weren't doing them. But anyway, we had this big idea, and this big idea was really about how we advance a new public health paradigm. And as you can see here, what is proposed in this model that we put forward, which I then wrote about in this article that I show up there, is having, of course, people and populations at the center, right? And of course, you have the academic healthcare system and public health. You have clinical care and public health working together. That's obvious, duh, right? Duh. And of course, you have the business. Of course, you have the urban community involved. Of course, but the things that we I think often forget are city government and the role that city and particularly politics play in shaping these issues. Why are we not having politicians at the table? Because they need to be at the table. Why are we not having politicians at the table to tell them, hey, this is what clinical care looks like, guys, and this is what public health looks like? And so when you go and pass your policies and laws, you need to know this reality instead of people just making up ideas in their heads about things. But also business and industry. You will all remember all too well, and I make this joke, during COVID, when the New York City Department of Health and Mental Hygiene, one of the world's oldest and greatest, created the vaccine registry system and it crashed. And my joke was, I was talking to a reporter the next day, I'm like, well, because they hired somebody over age 12 to design it. That's why it crashed. If we hired a 12-year-old, it would have been fine, right? So I don't think we are effectively leveraging in business and industry. One of my fantasies and my wild ideas during COVID was also, seems to me like a lot of people are getting Amazon at their homes, people of privilege and power. Didn't we like put an injector in there also to vaccinate them while they're delivering their packages for them? But that's the kind of out of the box thinking. And one of my favorite people who has done this work is somebody who you may be familiar with, who I was trying to recruit, but I don't know, we still might be able to get him, is Dimitri Daskalakis. Dimitri Daskalakis was at the Center of Disease Control in Atlanta. He was one of the four people who wrote the letters and demanded and resigned. And he was there with Mandy Cohen, who was there at the talk last night, which was amazing to see her too. Um, and when he was a young scholar at NYU School of Medicine at Langone, was working hardcore on HIV and STI infection in sexual minority and gender minority individuals, and did what nobody else had been able to do before, which was he was able to go to the clubs and the bathhouses and do testing. He went and met people where they are and he was able to detect infections, and he was able to write prescriptions, and he was able to do all of that stuff in a setting where people felt comfortable, where they didn't feel dehumanized, where they felt their life was respected. All of this led to my book, which is going to be out momentarily. P.S. I do love the Mad Men cover. I just got to say, I just love every minute of it. So this book is really builds on these ideas, and it's the idea that we need to bring humanity back to public health. I think the one of the questions that been asked last night is how has how has the over reliance on science done this damage? And my answer was because we've forgotten the people. And we've forgotten their fears, and we've forgotten their lack of empathy. And the person who's choosing not to be vaccinated is doing so not because one morning they woke up and said, I don't want to be vaccinated, or one morning they woke up and said, I'm going to have a heroin addiction, or one morning they woke up and said, I'm going to be obese. No, there's a lifelong pattern there of social conditions, familial conditions that are critically important in understanding if we're going to affect a change. We can't keep patching the problem. We have to go to the root of the problem. And in this dean's perspective, in this person's perspective, working with people, particularly between 0 and 18, when they're most malleable, right? When we can get them to understand what science is, when we can get them to understand what health is and how treatment is different from prevention. That's our sweet spot here. And that requires a humanity in how we talk to people and not disrespect people because they have different political beliefs than us. Yes, I have very strong political beliefs, but I'm not going to dismiss the person who has beliefs that align with RFK because I have to give that person the space to be able to have those beliefs and be able then, in a very calm and empathetic way, make my point and get it across. Fighting and screaming is not going to solve the problem for us in public health. It also means that public health has to do what I saw when I arrived at the school 8 years ago. Stop doing public health behind computers. That's not what public health is, really. And that's not the school I wanted to build. And this is, of course, what you get when you hire ACT UP guy to be your dean, right? You know, you're not going to get to school where people are just like running data sets. He's going to run data sets too, but he's also going to demand that we be out there working with people. So I share that with you. I'm happy to come back and talk about that book at some point in the future. Finally, here's my contact information, and I was able to leave some time for us at the end. But I loved sharing that with you. I honor the possibility of working further with the medical school as you continue to envision what it is as one big school, as you continue to establish. I talked to Amy and Bob when they first came to me and said, "Hey, we're gonna build things around health equity. Is that a problem?" I'm like, "No, that's a blessing. That's a blessing because no one owns that term. We should all be owning it together." So I look forward to being able to contribute to whatever adventure you all take to advance health equity and having you contribute to whatever adventures we want to take to advance health equity. Thank you for having me this morning.
Thank you. Thank you so much. I feel very inspired. I have a lot of questions and comments. I'll start with just a couple and really invite others who are, who are in this space or thinking about this, to put your hands up and we'll have a dialogue. First, I love the phrase you used it a couple of times of with and for the people. I think that is really, you know, key to how we can, advance so much related to health in this country, in New Jersey and in the country. I love the idea about more interdisciplinary training, the medical students and the public health students, and that opportunity. And talked about a lot about that and thinking about that. Um, the question I'll have really is around your vision that you presented and sort of thinking about how we get everyone involved, industry, community, public health, medicine, really centered on on populations. And I'm repeatedly struck I feel like how close we came, how much progress we made during COVID, actually, which was such a
Mhm.
horrible thing. And
Uh-huh.
I think in different places, first it's shown a light on how broken our public health system really is in this country, but I think we really did. People came together, and then,
Boom.
right, it sort of fell apart. So I don't
Right.
know if you have thoughts about that. Can
Mhm.
we, it was such a horrible time, I think our children are still scarred by that actually,
Mhm.
sort of the social deprivation they went through. But maybe think about that, or why did it take, how can we have move forward without a, pandemic driving us?
So I will first say that I believe that every crisis provides opportunity, and that's exactly what COVID did. And I think it's exactly what HIV did like 40 years ago. It provided an opportunity. We weren't talking about social determinants before that. We were talking about, I don't know what we were talking about, but certainly we weren't talking about community being at the FDA and stuff like that. So that changed things. But it didn't happen right away, right? It happened, but it happened over time. So that's my first answer to you. My second answer to you is I just think people were exhausted by COVID and everybody needed a breath, right? But I think there's something going on right now. And I think there is an attack on everything that we do that is energizing folks. And I think we need to harness that energy to our advantage. This is the moment right now, because now we've had a breath, right? And we're not going to all die of COVID, right? And we can bring the grocery bags into our homes, as we've learned. But this is the moment to be very, very, very strategic and say, you know what? I want people let's think about the farmer groups in New Jersey. Let's think about the companies in New Jersey, including, Amazon and places, and talk about one topic. Let's be very strategic. What is the one topic that we think matters most? And it's going to also be the least combustible for some people. I think it's maternal and child health, quite frankly, and gather people in a room in an informal way to have a think tank about it. I think people are ready for that. I think if we try to do everything, they're not. But if we keep it really specific and make sure that the table is represented, by the way, not only of industry and the city government and medicine and public health, but also students, your students, our students. You're like, I can't keep doing this for much longer. Like, I need the next generation to step up, right? That's how we do it. And I think there isn't, the last thing I said last night when Vin asked me, what is your takeaway? What is your one promising note that you leave the audience with? And my wonderful friend last night, who I got to meet, who works at Jamaica Hospital, her name is Shahiba Raouf, and she does this really amazing thing at Medicis, where they have this whole person care. She's actually really, you might want to invite her for a talk. She was really amazing. I said, the thing that gives me hope is that the people are angry right now. And I think you harness that anger and you bring it together and you say, let's do something positive out of it. I think this is the moment, and I think the moment is now, and we can't wait. We can't do the thing that universities usually do, which is like wait too long, right? And I think you're all thinking about it really, really effectively at RWJ. We're thinking about it public health, but we're thinking about it separately. And hopefully, my vision for a new chancellor is one who's able to break down these silos between our entities, so we're able to do this even in a more effective way.
Thank you. Dr. Hussein?
Hi, hi. Thanks so much for your talk, Perry. It was really, I, I sort of have your same sort of vision. I went and I got my MPH very far along in my medical career, as I saw the writing on the wall in
Yep.
2016, that, population health and would be the driver, and I really wanted to get my fellows into that space. I did my focus on global health. Um, what I will want to share is that I've developed a digital text platform called Your Health Kiosk, and the Blaustein School, as well as the Rutgers public health students, have all been working through me and doing capstones with me. I recently came back from Costa Rica, working with the Child Family Health International, and really understanding how to develop curriculum around experiential learning.
Yeah.
And I think that this is the future and has to happen.
Mhm.
I think that, maybe we can talk together more about having more students come do their capstones with us. Today I'm actually going to be meeting, as you're talking about government, meeting with the Franklin, the health department there. We've been working with the New Jersey Department of Health. It's been an
Mhm.
incredible experience for the students because they get to understand firsthand how barriers are actually defining health. But from a public health standpoint, they're really understanding how we work on policies, how we actually get to these individuals. And we not only integrate like the public health students or the Blaustein schools, but we also have engineering students with
Yep.
us. We have students from the School of Communication, from the School of Fine Arts, all working together because we know that that's so important to do sort of collaborative work and work to get like the School of Social Work works with us, School of Pharmacy, because we know that this is a battle that we all have to do collectively, and we really do understand that us living in silos is not going to work. It's not going to work anymore. And we also have to work globally as well as locally. So we also
Yep.
work with the Graduate School of Education
Yep.
because we understand that it's behavior. And then in terms of industry, we work with Google and Blue Vector, Gomo Health,
Beautiful.
because we understand that it's have to have all these partners to be able to make and drive change.
Sabiha, you like speak like to my heart when you say those
Yeah,
things,
I mean,
like
I think it
fully.
has to happen.
Yeah.
It is happening. I mean, we have like close to 2,500 individuals on the platform.
Yep.
These individuals are like, most of them are underrepresented, have no insurance,
Yep.
have no way to connect to the healthcare system. And, you know, finding a way to connect them has actually given me a different meaning of how to practice. Like, it has changed my life. I think that they've changed my life more than I've changed their life.
I get,
So
yeah, I appreciate everything you're saying so much, and I think you're right. I think that, there are the beginnings of stuff there, and certainly the work you're talking about is perfectly in line with that. I like to leave these meetings with like to-dos, right? Deliverables. And I think if I might propose to Gina and others that we bring a small group of us together to think about the things that Sabiha is talking about, and even making it even bigger and making even more people opportunities to do that, right? So do we bring our ed people with some of your folks together just in an informal lunch to say, hey, how do we continue to work together on practice, around getting even more capstone students into the medical school because our students need that, getting your students into our classes. And I think that would be a good outcome of this meeting if we really focus on the students because they want it. It's to be like
yeah,
they
they
want it.
definitely want
They
it.
want it. Right. No,
Yeah,
I think it's great.
I think that would be great, Perry. And I
I
know
wrote it down.
Dr. Chen, we give you 1 second. I think there are a couple of comments in the chat around sort of medical students and residency programs. So I just
Yep.
want to make sure you see
Yep.
those.
Yep.
And I did think a little bit about whether this maybe Dr. Dave, whether the public health students are engaged in Chandler at all, right? Which is the FQHC that we run. And there's a student clinic, a medical student clinic there and so forth. So I don't know.
They aren't, as far as I know. I think it's a great opportunity, though. Or do you know Perry otherwise?
You know who will know? Who's on? My amazing team that knows everything. Like, because when my students come and ask me what course am I supposed to take, I'm like, I'm just the dean. I don't know the answer to that question. Sarah, yeah, Sarah Kelly is on. Sarah, am I putting you on the spot? I'm giving you a moment to like breathe
Oh, she's
here.
been writing. Yep, she's been dropping in the chat. Yeah.
Sarah is our amazing dean for student experiences who oversees our practice experience. Sarah, can I toss the baton to you?
Sure, yeah. I'm writing Dr. Hussein an email right now, so I appreciate this. Yeah, so we have, like I put in the chat, we work with at NJMS the preventive medicine residents. We have a program where they get their MPH through us during their residency. Also, the occupational medicine residents get their MPH with us through their residency program. Also, there's some credit sharing. They don't do all the credits. I don't know exactly how that part works, but we do try to make it as streamlined as possible because we know residents are very busy. And we would love to expand this to other programs. We also at NJMS right now, or through NJMS, we do an MD population health certificate. I'm sure with everyone merging and working together, that'll be expanded, and we would love to expand that even further. And then my office also manages the experiential learning component for the MPH students. And we do not have students in Chandler at this point. I would love to have students at Chandler. I think that would be great. I co-direct an interprofessional experiential learning program in the summer where we have MP students from all of the different Rutgers health schools work together, and I mean, it's incredible. It's life-changing for the students to really have that experience, and I think it's really important for situations like that where the public health students are also seen as experts. And I think that helps the medical students and the other clinical students really with that interprofessional component in the rest of their training. But yeah, I would be happy to talk to anyone. I'll put my email in the chat, and whatever we can do to connect with the medical students, I think would be great, and we welcome that.
Great, thank you. Peter Blumenthal, you have a question? Your hand is up. You may need to unmute.
Good morning. I'm Peter Blumenthal.
Good morning,
Thank you
Peter.
for this amazing presentation of your widened program, from which I graduated in 1996. I happen to presently serve as president of the Medical Society of New Jersey, and our mission is to promote the betterment of public health and science and the art of medicine, to enlighten opinion in regard to problems of medicine, and to safeguard the rights of the practitioners of medicine. It occurs to me that I should speak to you because we have to strengthen our cooperation and make it a formal one. We would love to participate in the programs, enhance them where we can, and love to give you access to our newsletter that goes to many physicians in New Jersey. I will send you an email with the information. And again, I thank you.
Thank you so much for your comments and congratulations on being a graduate of our program. So I think that anything we can do to assist, we want to. I mean, I will say that, this is a school that really wants this. And 8 years ago, it was a school that was very insular, and we're not doing that anymore. We haven't been doing that. And so anything we can do to help you and you can help us, we want to. And please just, Peter, reach out. I put my email there. Also, everybody, I put my slide deck in there also in a PDF format, so you will have access to it too. And I want to just thank Sarah for sharing with us what we're doing in terms of our experiences, our student experiences office in our practice. Please bring, yes, students, Chandler, yes. We have 250 MPH students that come in every year. Right. So we are always pressed for really high level opportunities to work with clinicians and others in real life settings. Thank you, Peter.
Sure. Any other questions? I think you touched on a little bit the sort of misinformation or distrust that's been, I don't know, heightened, I guess now we can say. I was reading this morning about the rates of refusal of vitamin K after birth. Just really, we have a lot of work to do. Dr. Chen, I see your hand back up again.
Yeah, I mean, maybe speaking to that, I just had a question about where would conservative voices have a home or feel comfortable kind of getting this, this training. I grew up in the very, very rural, Oklahoma, and kind of ended up in academia, et cetera. But when I think about, healthcare back home and people who are distrustful of, academic elitism, et cetera, I can imagine environments like this to be incredibly intimidating or, everything that's, going wrong in the world. So, how do we bridge that gap?
Joe, I don't think I think I see it a little differently. I mean, I grew up in Queens, New York, where with other people who are Greek, and 60% of them are MAGA right now. Okay, who the people I grew up with, right? And so this conservative voices happen in Queens too, right? So it's right in our neighborhood here. So I think the answer is not we just have to have room for conservative voices in the classroom. It has to be allowed. And so one of the things we have been working on at the school is to enable that enable those voices to come forward in a way that is real. And in the book, what I talk about is not dismissing those voices in the healthcare setting, right? Like like you are the touch point for those folks. You are the person that they come to. You need to not dismiss them. You need to understand them, and you understand how to get them. And then we need to figure out strategies. This is the how part. This is the hardest part for changing their minds. And one of the themes that came out yesterday in the conversation, which I think strongly believe in, is this notion that we have to have people who feel, look, are like those we serve, right? Because they're going to trust that message much more than from somebody else. I tell you this one story because I'm Greek and I'm a storyteller, and the Odyssey's coming out on July 7th, and I am waiting every single day for that movie to come out. Okay, so I went in 2020 to my cousin Elena's daughter's engagement party because they're Greek, so they have showers and engagement parties and weddings, and it's just like the movie. It's just like the movie. The movie was accurate. Um, and I sat at a table with a gentleman and his 10-year-old son and his wife, and we were talking. This was like right. We were beginning to come out of COVID a little bit, and he was like, "Oh yeah, no, my wife's vaccinated and my kid's vaccinated, but I'm not going to do that." And I spent an hour of that party gladly doing this because it was more interesting than the party, talking to him about him not getting sick and seeing his son grow up. And I said, one of the great tragedies in my life was that my father avoided his health for so long. And at 57 years old, he died. And he never got to see all of the things that I've accomplished and all of the things that he's worked for. And that, I felt that, and I asked him, did he want to see this for his 10-year-old son? And that the COVID vaccine, while it wouldn't assure him he would be there in 30 years, would at least was another step in the direction of keeping him safe and alive for the short period of time. And it was an interesting conversation. And I give it as an example because I didn't judge him, right? I didn't say he was dumb. I understood where he was coming from, and I made it personalized for him. And I think this is where we fail very often in public health, where we think this is in the book. This idea that people are rational operators, that they make decisions based on their cognitions, but no, they make decisions based on their emotions, their lack of empathy, their belief system, their information. And I was able to change this man's heart. So I guess what I'm saying to you is hearts have to come first and then minds. And the people who are delivering the message need to be like the people whose heart we're trying to change. And this includes conservative people. And many of you know diffusion of innovation theory, right? You know this theory. It's a theory in public health. You have people going out into the community who are like the people whose hearts are you trying to change. You train them with the skills. Because certainly in conservative Oklahoma, there is someone who feels like, looks like, acts like the people in the community, and then is able to go into the community and have real conversations. That's how I think the change happens at the grassroots.
Wonderful. With that, I think we'll close. We're at time. Thank you again so much
Gene,
for
anytime for
joining
you.
us. I hope we follow up on those action items
I
and
will. I will
wish
follow up.
everyone else a great day.
Good day, everyone. Thank you for being here, everyone. Bye.
Thank you.